Alarming new statistics from the State Department of Health. It found the prevalence of severe maternal morbidity during childbirth jumped from just over 50 per 10,000 deliveries in 2011 to more than 100 in 2020.
And it also showed significant racial inequities in the unexpected complications of labor and delivery, with the highest rates coming for those complications among Black people.
So here to explain what this means is Dr. Nawal Noor, the chair of the Department of Obstetrics and Gynecology at Brigham and Women's Hospital. Dr. Noor, thanks for joining us. So this report, it talks about this dramatic spike in rates of severe maternal morbidity. What does that mean?
It's concerning, right? It means that we're actually getting to a point where we think we were trying to improve the morbidity and mortality of birthing people and mothers, but we're not doing a great job. Now, I do think that our mothers are actually coming to us with advanced maternal age or diabetes and chronic hypertension, but we know that, and I think that there's a lot of work that needs to be done to improve these numbers.
All right, so the morbidity rate went up for all women, but especially for women of color. They continue to see even higher rates of complications. Why do you think that is?
I think as we look at our systems, we clearly have systemic racism. When it comes to thinking about patients as they come into our hospitals, they are not seen, taken care of in the same way. I think we have to acknowledge that and understand that we all have implicit biases. And so as we are listening to patients or hearing what they have to say, we may listen differently or understand them differently, depending on their race. As you look at the CDC, it's very clear that it's not just a Massachusetts problem, it's throughout the United States, that Black and brown women are 3 times more likely to die during or after childbirth than white women. And so this is a truly nationwide problem.
So medical professionals need to kind of listen to complaints, obviously, and listen carefully. What else do you think can be done to reverse this trend?
So I think, from a provider perspective, I think we do need to listen to our patients, and listening means understanding what they have to say. So some of them do not speak English or speak English as a second language, to ensure that there's an interpreter service involved or an iPad in every room. I think we have to think about how they advocate for themselves. And we have a doula program here at Brigham and Women's Hospital, Mass General Brigham as well, where we have patient advocates that will come with our patients to ensure that they are listened and heard when they come with issues and concerns. And then I think finally, we should also, from a systemic perspective, really think about how we educate our providers from implicit bias training, standard training, and systemic racism and health equity, so that we actually can really focus on the policies that have to do with safety, equity, and quality as well.
All right, Dr. Noor with the Brigham, we appreciate your time. Thanks for lending it to us.
Thank you for having me.
Yeah, thank you, doctor.